Let's turn to what happens after treatment. How is the effectiveness of the treatment monitored?
Well, so depends on the doc to some degree, but I like to do some what I call interim imaging. So we'll typically, again, depending on the stage, but very often we're delivering 6 treatments of R-CHOP, usually given every 3 weeks. So the total treatment course is about 4.5 months. It can be a little bit shorter for patients who have stage 1 or stage 2 DLBCLs. I like to get interim imaging, which is either a PET scan or a CAT scan done sort of in the middle of treatment, just to give us a sense of how things are going. Are the lymphomatous tumors shrinking down? Some patients are, even by the middle of treatment, are in a complete remission. Their PET scan has gone totally normal. And then at the end of treatment, that's probably the most important imaging. And there I do like to do PET scans again. Again, they're the most sensitive test we have to detect lymphoma. And so at the end of treatment, usually about 4 to 6 weeks after somebody completes treatment, we like to get that end of treatment PET scan. And that's the PET scan that allows us to say, you've had a complete response, you're in a complete remission or not.
So what does remission mean exactly then?
So in DLBCL, remission is pretty simply defined as absence of disease on, or absence of cancer on the test that we do to detect it. Again, typically PET scans. And if somebody had involvement of his or her bone marrow at the beginning, before treatment, we'll repeat that bone marrow at the end of treatment just to make sure that there's no lymphoma left over. And so, but for most people, it's a PET scan. You know, if the PET scan does not show any abnormalities, then that's what we call a complete remission or a remission.
Is a cure possible for patients with DLBCL?
Cure is not only possible, it's actually quite common. If you look at all comers, regardless of stage, age, what have you, approximately 60 to 65% of folks who are treated for DLBCL are cured. The cure rates are higher with folks with earlier stage lymphomas, but even folks who have advanced DLBCL are frequently cured.